Today, I would like to share with you our experience of simulation platform usage as a tool that is very helpful and prominent for research skills development within the medical curricula. Briefly, I can present myself as a representative of the private medical university located in Tbilisi, Georgia. And as we already turned 30 years old, and as we are open for any kind of collaboration in field of research as well as the medical education, please feel free to contact us in case of interest to do something together. On this slide, let me to share with you the content of today's presentation. Of course, I will share with you the learning outcomes. Those will be achieved as an outcome of our today's session. And I would like to share the achievements and point to those we did together with the CyberPatient, this helpful tool for the simulation platform. First of all, we placed the research line in medical curricula. I will share with you our opinion and also expect to get some questions as well as your points, how it happens in your university, in your medical curricula. Also, I would like to share our point, how it is constructed, and will be happy to listen how you are dealing with this problem, because maybe I can learn something new and incorporate it in our curricula as well. And challenges and perspectives. Challenges are always with us, and as we have the challenge, also it's possible to have some new escapes and ways of the development as well as the collaboration. Long story short, some data about the TMA medical curricula. In 2020, just in advance to the pandemic, we were accredited according to the WFME standards. So just in the first days of the pandemic, whenever we still had the travel and etc., we had the experts visit in Georgia and Tbilisi, and it was the last visit before the pandemic. Main principles, those we are highly appreciated and highly evaluated by the WFME expert, was the integrative teaching approach that we have implemented, also portfolio for our students, and educational lines, those we have in our integrative curricula as well. Research line, meta-medica, public health oriented, as well as the clinical reasoning incorporated with the clinical skills line. Just today, as I am responsible to share my information and data about the research aspects, I can highlight that research line within the 12th semester medical curricula includes the 6 learning courses or modules. Those in total acquire 17 ACTS credits, and they are dispersed at the different semesters. Of course, you can guess that the main focus is given to the first semesters, just to have, first of all, the introduction point. That's why the first year in our medical curricula is incorporating the 2 learning courses, academic writing and introduction to medical research. They are providing to the students just the basics of the research skills, and afterwards the different combination of the research line dedicated projects are presented in upper semester, in 5th semester, as well as 7th, 11th and 12th. Pandemic. We do remember very well that during the January of 2020, all of us, we are looking over some information. So what happens with the new virus, where it is dispersed, what happens with travelers, what about the clinical symptoms, how severe they are. In any way, January 30, gives us the point of the public health emergency situation of international concern, which afterwards, within just several weeks, converted to the pandemic declared one by the WHO. And here comes the point with the global crises, which affects the healthcare system. First of all of us do remember very well the challenge for the Italian healthcare system and also afterwards to the US healthcare system. Georgia also was among this challenge as well, but not only healthcare, economics, agriculture, and education were affected, especially in case of the challenge related with this pandemic period. I would like to highlight, because of my, first of all, affiliation to the medical school and the professional competence, that pandemic, and all of you hope will agree with me, gave us the challenge for the medical education as well. At the time, whenever we had the lack of the protective equipment essential for the clinics, whenever our medical doctors were complaining to the long shifts and sometimes 24 hours were not enough to deal with these problems, and change in regular routine in our everyday practice and healthcare. But at the same time, from another perspective, as the challenge always gives some perspective, technologies for healthcare were implemented intensively. For example, it was the case whenever we were able to prepare the vaccine in very short time because of the collaborative effort. And also, e-health, the field of concrete healthcare practice about which we are talking. Is it essential to implement it? To which fields we are going to implement health, in which scenario, and etc. We find that it's rather helpful in the pandemic era. Also, if we are considering what pandemic stimulates in our everyday practice, in medical education, it was related with the problems of the clinical skills development process because of the canceled rotations in clinics as well as hospitals. So it was a severe problem and very important global problem that we cannot ensure clinical practice to our students. Also, we are it was the point and the challenge just to perform the learning process online. So by the first glance, it's so confusing. Clinical skills, healthcare practice, attitude, empathy, and all other skills, those are building up the healthcare professional, how they can be developed during the online performed learning process. And of course, assessment. Yes, all of us are talking about the open book principle, and theoretically, all of us agree about this possibility, but are we ready, and were we ready during the pandemic period to perform the assessment online? This were the main challenge, at least for our team during the pandemic period, how to manage the process. And today, I am happy to mention that our Dean's Office performed this challenge in an excellent style. At the same time, again, as usual, pros and cons of the process. Some solutions for medical education were provided too during the pandemic process. Telepathology and teleradiology. The fields, those are still somehow neglected, but all of us declare their importance. They come on the first stage because it was rather helpful and possible to realize and incorporate them, integrate them in learning process. Virtual patient. Another possibility, okay, students are not able to attend the some sessions at the clinics and hospitals, but why not present them as a simulation, the patient, just to give them possibility to practice in their clinical reasoning and also find out how the communication shall be performed, which kind of questions shall be asked to the patient. Okay, and here comes the research and its importance. Today, all of us agree and declare that evidence is of utmost important, and even we are considering the evidence-based medicine. Evidence and source of it is, of course, research, but today we know that without research, it will not be possible to generate the vaccines. We have the Nobel Prize, which is given in physiology and medicine. And also, yes, laboratory practice is very interesting, amazing, but not every healthcare professional likes and is interested to do it. And yes, without polymerase chain reaction, we will not be able even to deal with the COVID-19 issues. Evidence that we need is driven from the lab, but okay, how we are stimulating and how we are interesting our medical students with research. Because first of all, we have a dream to become a doctor, and even it was declared and reported case whenever one concrete guy addicted and infected by the idea to become a medical doctor tried to pass the exams for the decades of years, and with a big dream just to join this team and operate in the surgery room. Also, whenever such kind and other students are entering the doors of the medical university, and in the first and even second semesters, instead of the clinical rotations, instead of the joining of the excellent and professional teams of surgeons or even the any other specialists, they shall prepare the essay or even the paper review or formulate the hypothesis and so on. That's why the main questions, those I heard from my students and would like to share with you today. Why shall I review the articles instead of the going to the clinic? Why shall I formulate research question, how it's related with the communication with patient? Research line in MD curricula, it was the main point of my students. It's not essential, not appropriate, and ineffective usage of my time during the semester. And is during the online period, I saw the too many attractive points specific to the simulation platforms. Here comes the point, the CyberPatient, and the platform inspired us about the possible alternative performance of the research line within medical curricula. First of all, key points specific to CyberPatient, those all of you are aware. Available clinical cases sets, more than 100 clinical cases, as well as the opportunity to add your own to the library. Interface, which is not very complicated and does not need too many IT skills. So if you can operate with the computer, you can work with the simulation platform as well. And track record of successful implementation, so we can see what are our strong and weak points. That's very important. By consideration of the CyberPatient, it was our approach that 12 semester students, 56 students of the 12th semester, those we are absolutely skeptical to the research line, to the formulation of the case report in a style that is requested by the scientific journals. We tried to give them assignment. Assigned the two cases of CyberPatient together with my colleagues, we decided which cases will be interesting for the students. And also, after the presentation of these cases of CyberPatient, after the independent work of the students, and this independent work included the assignments like the formulation of the PICO questions, general background, as well as the foreground one, related to the both cases of CyberPatient. Then just to prepare the poster related with these cases, and only afterwards construct their own case report by all this data. Of course, for each case was given the concrete deadline, not very short. Around the 10 working days we are given to students to perform the case report. But in case of the PICO questions, as well as the posters, the shorter deadlines we are given. For example, the students we are requested to prepare and formulate and send the PICO questions within 24 hours after the review of the case. And for poster, it was given 5 working days. So not very hectic, but not very relaxed point. We find out that even in case of the mandatory request, just to check for the academic integrity issues by the usage of the Turnitin platform. And also, as we checked and requested that every case report as well as the poster shall be in line of the academic integrity and requests of our university, we find that it's achievable goal. In practical, we saw that students were not only able to realize these assignments according to requested standards of academic integrity and deal with deadlines, we saw that in such case of assignment, similarity level that was checked by the mentioned software Turnitin was less than 5%, which is practically nothing whenever we are talking about the medical data, whenever we have the match with terminology. And also, such less than 5% of similarity was not just a single cases. It was seen that 95% of all submitted case reports are in line of this idea. Also, of course, it was interesting for us to see how many students we are assigned as the grade C in their evaluation, grade B, and etc. As you can see, the main point was given to grade B. Of course, we had the grade A students as well, and grade C was also presented. But as you can see from the presented data, the most part was given to the grade B and grade A receiving students category. Just to compare why we decided to present you today such kind of data, our previous experience, whenever we performed such kind and same assignment with students of the 12th semester, but without usage of the simulation platform, gives us a similarity index not less than 18% and up to 25%. And such similarity was presented in 55% of submitted case reports. At the same time, just to compare, if in CyberPatient application for the research line purposes, we had the main point of the grade B evaluated students, here in the previous experience without CyberPatient, it was just only 28%. And just only a few students were graded as A. Yes, the shift was mainly for the grade C evaluated students. So by consideration of this issue, we find out that CyberPatient somehow neglects the point that the students are undergoing the research activity and performing the scientific communication. They were doing something that was very similar and close to their future profession. They were working with a virtual patient. That's why they performed this very easily and without any complaints and without looking over the resources in the internet. Simply, they consider this like the patient and deal with this problem. Lessons learned. Students can do such kind of assignments and can follow the all requests and standards defined by the academic integrity principle specific to every institution as well as generated in general. Also, as each learning course and especially research line specific courses have their own specific outcomes, they can be met as well. In our case, it was just the different ways and patterns of the scientific communication, like the poster presentation as well as case report. And at the same time, during such our experience, we find out that students were enthusiastic and motivated to do these assignments. Moreover, they ask the questions how in the better style to perform this essay, how to better organize their case report. They were interested to see the different templates from the different scientific journals. So instead of just complaining, so why case report and how it relates with the surgery learning course, even I did receive the questions, is it possible to do the same after the learning course finalization by the usage of real data of patients, those we see in the different clinical rotations? So students became interested, and it was the opening of the Pandora box that it's not anymore just review of the papers without any link with the clinical practice. They find out that it's related with their profession. Also, we had the point that what else can be implemented and widely used for the research line. In other activities, those we tried and tested as well, it was anatomic table, which is the possibility of augmented learning with cases, clinical cases of radiology. Those are incorporated anatomic table. And here we use the approach that each student of the concrete, not the 12th, but the 7th semester, those are enrolled in the research line learning course. We are assigned with the individual cases from the anatomic table, and they review these cases individually, and afterwards assignment was the same. They shall write the case report by the usage of this data. Again, we find out that students can do this assignment very easily. They can follow the academic integrity standards. Similarity level was less than 7% in all students of this 7th semester. And as you can see, whenever we evaluated the case reports written by the usage of the data of anatomy table, the most part of students and papers were evaluated by highest points, from 35 up to 40 points. 61% of all enrolled students were evaluated. Afterwards, we had the middle points again, and just a few were receiving the passing score only. 20 points were just passing score for this assignment, and as you can see, only 2% of students received this passing score. So, future perspectives. The long story short, whenever we tested these possibilities and opportunities to use the different clinical reasoning dedicated platforms in research line, the main point for us was the identification of the another possibilities. First of all, students are ready and are interested to deal with the clinical reasoning cases as early as possible, because it was their choice to become medical doctors. They are interested with their future profession, and they want to have the feeling that they are practicing medical doctors. That's why seems that in case of the proper management and proper selection of the tasks, the simulation platforms, as well as the any other possibilities related with the giving the students the clinical cases and clinical situation, even with the computer, gives us the better examples and better possibilities. So early integration of clinical reasoning cases is our main goal right now in the medical curricula. But just to realize this everything efficiently, because as we are all aware, it's always interesting to change the modes, to change the attitude, styles, and etc. Different approach shall be used. Today, I shared with you experience with the simulation platform and AnatoMage table only, but also it's possible to have the mixture of any other combinations, as well as the different assignments can be formed. For example, even the so popular among the scientific journals, the graphical abstracts, or even the awareness posters, just to remind the colleagues and peers about the features specific to this condition, or even the lab diagnostics principles, and so on. So here comes the point and the stage for the imagination, what to do and how to use in different approaches and in different scenarios. But everything, yes, based on us and on our imagination, how to use these possibilities effective, for sure, and highly promising. That's the truth. Thank you, and I will be happy to answer the questions, if any.
Thank you, Dr. Ekaterina, for that enlightening session. All of us here gained a lot of valuable knowledge and a new perspective on the relationship between simulation education and research. We would now like to open the floor to any questions. Please feel free to raise your hand and unmute your mic, or type your questions in the chat. And we did have a question sent anonymously. Just regarding one thing is, I liked what you said about evidence-based medicine and how the importance of now evidence-based practice. So one of our questions here was, where do you see the future of the research line evolving in medical curricula in the next 5 years?
Okay, thank you. Very good question, and which always is the point for the discussion, because the clinical subjects and enrolled professionals are always mentioning that professionalism as well as the clinical skills development is important. So that's why it's the life science and any other science generation, those will give us the evidence. But that's reality, and that's true, that not every medical doctor, MD graduated student has the interest to join the team. Some of them find their careers as researchers, participants of the clinical trials, and etc. That's why I guess, and that's my belief, that we shall equip the medical MD program students with essential skills to collect the evidence, at least collect, and whenever they are collecting, to analyze, because it's the part of the clinical reasoning. That's why my subjective point is that research takes more and more central point in MD curricula. Even to deal with the pharmacology in the era of precision medicine, it's impossible without the evidence and without research, because we have the drastic change in this knowledge as well as the new objectives.
Awesome. That is a great answer. In any industry, research is very critical, but especially in healthcare and medicine, it's
Yeah.
how we grow and move forward as an industry. Do we have any more questions? Please feel free to write them in the chat or unmute your mic. We have one here. As a student, how can I use CyberPatient for research purposes?
Okay, also an excellent question. Now, CyberPatient is an excellent possibility to test and see what happens with this patient again and again. Because honestly and for sure, no one will be so patient whenever the student is asking the same questions again and again and request can you give me these lab results once again to see what happens. From this perspective, I guess, and it was our attitude that we tried to implement in the International Rare Diseases Day, just to present the condition by the usage of the CyberPatient platform, and afterwards, whenever the student identified what's the healthcare problem, look over which kind of research is ongoing on this topic, which kind of clinical trials we have, what are the gaps in our knowledge, what we shall focus further additionally to better serve our patients, because it gives us an excellent possibility. What is unusual? Why it's unusual? What is the background? Do we have all knowledge about this concrete data, or something shall be investigated further? That's why CyberPatient is excellent possibility to inspire research projects by the students, and at the same time it's an excellent possibility to master the skills of the science communication. Excellent possibility to master yourself with the saying long story short and don't miss the most important aspects.
Lovely, thank you. Using new technology, especially virtual simulation, opens a lot of opportunities for research, like you're mentioning. So, and if anyone is interested in CyberPatient as a research, please reach out to one of the members of our team. We are always open to new research opportunities. We do have another question here. As a faculty member, what is something that you're very proud of that has changed in healthcare education, and that you might have been a part of in the change in healthcare education from when you were a student to now as an educator?
Well, good question, Nikki, because it's always the point. Now, from this perspective, it gives the different opportunities for sure, but it also depends on the students and those are enrolled. Because with this group, you can use this scenario and it work well. But in another group, something else shall be found out, or they already are aware that you are doing this and they are prepared and looking over you. So what happens here and how you are going there? So that's why it's the change. I tried by myself to share with my students my own research project, basic one in molecular oncology, without anonymously, of course, and ask what will be the problem with this project and how you will develop it. And honestly, I can declare that I learned too many things from my students because they find the different aspects, but it depends on your openness. Are you ready to accept these suggestions from the student, or is the point that I know it much better? So first of all, leave me alone. I will test my own hypothesis. It's the point. What will be the attitude? I guess that in 21st century, the main point is just to have the student-centered approach and medical curricula. Whenever it does not mean that student decide what to do, but student-centered for me is just to give them the best possible solutions, and by the end of the activity, analyze what can be improved or replaced.
Awesome answer. I'm sure we have a lot to learn from from the points you brought up there. Thank you. Do we have any questions coming in from the chat, or does anyone have any further questions? Yes, and if you would like to reach out to Catherine at cyberpatient.ca to inquire about any research purposes or projects. Another question here, how do you see research changing as new technologies in virtual simulation evolve or are introduced?
Okay, it's a great question. Thank you. It's the hot topic, I guess, and Reid underlined the artificial intelligence in research because ChatGPT is for everywhere. Of course, it's the possibility, and I suppose that the different plagiarism checkers cannot identify the language and style of the ChatGPT. But by myself, I can share my own experience because I also was curious and give some data to the ChatGPT and ask to formulate the hypothesis and etc. and also request for the references. Unfortunately, our references were the fake. Because I rejected them and also comment in the chat with ChatGPT that you gave me the fake references and didn't receive an answer. I'm so sorry, I'm not human being, I'm not able to check the all references, but that's excellent. It depends on our approach, how we are going to use this artificial intelligence. All of us know that for today, as I do remember correctly, up to 35 artificial intelligence platforms are approved by FDA in radiology. That means that whenever we have some routine tasks, artificial intelligence can be helpful to give us some hints how to diagnose this issue. Not that they diagnose, but give the hints to be sure that the specific details and accuracy of our diagnosis will be achieved. But it's another point how to communicate with our students about this approach. I suppose that they can use it for the abstract formulation of their case reports, individually prepared, just to learn the style, how the abstract shall be written, not the hypothesis formulation, but for the formulation of the abstract. Also, it was a good experience. I tested my own questions because I am teaching the biochemistry and genetics as well. And very often the students are complaining, this question was not very clearly formulated. I tested it with ChatGPT as well. And whenever ChatGPT was able to answer them, that means that it clearly formulated. So it depends on the approach. It's like the cat and mice. It's important. We cannot ban it from the usage in the academic environment, but it's another approach to teach and educate the students how properly use them to have efficient tool in their own hands and not only simply the chatting point that I say blue eyes, what does it mean?
Lovely. Definitely very interesting answer, especially because new technologies like ChatGPT are what you said, they're a tool. Yeah. So you can choose to use them effectively or not. And it's a way to now educate students on how to use it as a tool. Lovely. We have another question here. What are your thoughts on using AI for future team training, like bringing nurses, pharma students, and medical students together to practice? And do you think this is a missing component in current traditional curricula?
Great question as well. Based on my idea, how I will construct the medical curricula, if I will have the full responsibility to do this, I guess that it will be very helpful to educate the students to identify the possible risks in the concrete procedure with the artificial intelligence. just to calculate the risks and probability, and based on this, make the different plan A, plan B, and C of their activity. Of course, the calculation of risks does not mean that we shall fully trust on the artificial intelligence solutions. No, but it might give us some red flags, those whenever we are tired, we did not see, envisage, or even cannot predict. That's why it can be helpful and will be helpful for sure. But I am against the idea that artificial intelligence will replace the humans. No and never, because we made the artificial intelligence. That's why this means that we are at least one step ahead.
Awesome. I love that. Another question here. You mentioned earlier about open book examination. And as there's a talk to move away from standardized examination, what do you think research and medical curricula can sort of support that transition or that discussion even?
Oh, excellent question and very hot topic for this issue. It depends on the approach that we are incorporating in the learning process. Based on my experience, never mind which subject I am teaching, it will be biochemistry, genetics, or research, I think that my mission is complete whenever I gave the students enough skills to find out the data by themselves, because it's not possible to memorize everything, but at least if they are aware where to find, and whenever they see that it's exactly what they are searching for, I mean that my mission is done. From this perspective, research as well as the open book are practically the same, because research is open book. You shall have the skill to read this open book. Otherwise, we will look over the excellent report, which will be awarded by the Nobel Prize and did not get its content.
Lovely. Yeah. So as we transition from into more open book practices, research falls perfectly into that, as it's the general definition as being open book and understanding. Yeah. Awesome answers. Do we have any more questions here for Dr. Ekaterina? We have another one. What if any risks have been identified when using simulation platform for clinical practice?
Okay, first of all, generally we cannot teach about everything our students. We are giving them just the basic skills, and it was the same point and opinion in our team as well. Whenever we first time practiced the and piloted CyberPatient and different other simulation platforms, we find out that it's not developed in line with Georgian legislation. The medications are a little bit different, and so on. Okay, but it's possibility to learn something, and whenever you crack this case and whenever you diagnose it correctly, afterwards no one is giving the restriction to formulate the treatment approach according with your national legislations and see. And also, okay, it might be the point that we did not exactly agree with this scenario of this simulation platform. Saying that I disagree, it's very easy. But in healthcare professional and in medical practice, it's important to provide the arguments why exactly you disagree, what are exactly you think the weak or strong points, why your opinion is correct. So argumentative decision, and this is another skill how we are preparing our medical students for the clinical boards as well, because it's another skill to listen your peer and not say only I disagree. Give the arguments and ask the questions why someone else is thinking in another style, maybe I am wrong. Maybe I missed something and did not judge properly concrete data. All of us are humans. That's why it's another point.
Excellent answer. Definitely one of the lessons we're learning when you have an international simulation platform is, every best practice changes from country to country, even hospital to hospital within the same country. And it's a great skill not only to to identify differences in your own practices, but actually be able to have the processing and the understanding of why it's different and why your opinion might be right or wrong, depending on the situation. Excellent answer.
Thank you.
One thing that we have another question here is how do you find the confidence levels of students change when using a simulation platform, whether it be virtual or a physical simulation?
Okay, again, the very good question. And here comes the main point. It's the style of the students, how they are working and learning. Generally, they prefer to do it in groups. That's why even if I will give them instruction that you shall do it independently, I guess that they will not do, and I have no possibility to check this. That's why it might be the trust that they did this independently as well as in a group. And here comes the point how we are constructing the questions, what we are asking. What is our scenario of the performance? What exactly I want that the students learn from this simulation platform? Just communication skill? I don't think so. Just the analysis? Yes, exactly. This is my goal, because they shall take all details and made the puzzle of the clinical condition. Here, based on my expectation, and as all of us agree that medicine is multidisciplinary, team-based activity, I guess that a group work is okay.
Another excellent answer. When entering the real field, one of the lessons we're learning is students learn in an individual basis, and then when they're thrown into a hospital or clinical setting, that is all team-based. So definitely coming into these simulations with specific learning objectives from a team-based approach, and simulations are meant to incorporate real life experience. So why not throw in that team aspect? It's evident in real practice. Excellent.
And one more argument. All of us can agree that whenever we are repeating to our students the same data, they are listening, okay, they are memorizing, but whenever they are explaining or whenever they are listening each other, they remember it much better.
Excellent. Definitely. As a student not too long ago, I can relate to that fact for sure. It's very, very true.
Yeah.
As we is there any more questions before we wrap up this wonderful expert series? Okay, well, thank you for all your questions, and please stay tuned for the recording of this expert series. And once again, thank you all for joining us and for your participation. And a big thank you to Dr. Ekaterina for your excellent lecture. We love opportunities like this to bring together a global community of educators and learners to discuss topics that will hold a critical role in the future of healthcare education. From the team here at CyberPatient, we hope you have an excellent day.
Thank you. Thank you very much for this great opportunity, and I will be happy to continue the discussion as well as collaboration on this topic further with all participants at CyberPatient as well. Thank you very much. Thank you for being with me.
Thank you so much, Dr. Ekaterina.